Hi everyone, my name is Molly McQueen and I'd like to thank you so much for meeting with me to review the progress report for LP regarding his interventions here at this school. So looking at his client summary, I just want to first note that we will be referring to him using the first and last initials of his name to protect his privacy and confidentiality according to the BACB Ethics Code to ensure ethical practices within the scope of our intervention. So LP is a student here that we have been providing services to. He is 10 years old, and the target behavior that we have selected for reducing is his hair pulling of self. Here you can see we have a target behavior definition that has defined his hair pulling of self behavior in very measurable and countable terms to ensure that we can have accurate data collection with this behavior definition in a way that we can all know what his hair pulling of self looks like. So also looking at the hypothesized function for this behavior, we can say that we identified two functions for his hair pulling of self, being access to tangibles, and the second hypothesized function being access to attention. In evaluating the social significance of his hair pulling of self behavior, there are a couple of things that I do want to note, as this is a socially significant behavior. First, in that as hair pulling of self is a self-injurious behavior, research has indicated that if not addressed, this behavior could potentially become more severe over time, which is why we prioritized selecting this behavior for intervention. The second piece here that I want to note is that in decreasing and reducing this behavior, this could present some very meaningful outcomes for LP in terms of improving his quality of life, such that we could increase his interactions with amongst peers or teachers or staff, and also increase reinforcement in less restrictive environments. So now looking at the brief intervention summary, this is just a summary of the 3 intervention components that you guys have been implementing across the last 6 months with LP. First, speaking on the antecedent strategies, you guys have been using non-contingent reinforcement with him, and this has been implemented outside of opportunities of when he's engaging in their replacement behavior, so really capitalizing on maximizing that reinforcement here in the school environment to ensure that outside of when he's engaging in those replacement behaviors, he's accessing reinforcement. And the next piece we're going to talk about here quickly is the consequence strategies. You guys have been using differential reinforcement for alternative behavior here, and this has been in response to when he is engaging in that hair pulling of self behavior, such that you have been delivering reinforcement every time he's engaging in the alternative response. So that being when he's requesting for access to an item or an activity or attention, such that we are delivering reinforcement for this response and the engagement in that self-injurious behavior is no longer being reinforced. And then finally, looking at the replacement strategies, you guys have been implementing the functional communication training here to teach LP that replacement behavior of engaging in the functional communication response. So this functional communication response is such that he is engaging in requesting access to an item or activity, or he's requesting access to attention. So here it might be, hey, I want a high five, and then the staff immediately provides a high five to him because he's requested access to that. So you guys have done an excellent job with providing continuous and immediate reinforcement every time he's engaging in these functional communication responses. Next, we're going to take a look at the progress evaluation and data monitoring, specifically relative to the treatment integrity data that we've collected over the last 6 months. So we have been collecting data with fidelity checklists to measure the integrity of our interventions that we've been implementing with LP, just to ensure that there is a high degree of accuracy with the interventions that we've been implementing, as this data is being utilized to guide the treatment decisions that we're making for LP relative to his interventions. So over the last 6 months, we have been collecting fidelity checklist data. Initially, it was at a weekly basis for the first 3 months, and then it shifted to a bi-weekly basis over the course of the last 3 months. The behavior analyst and school psychologist were the individuals responsible for collecting this treatment integrity data. And as far as the fidelity data results go, research indicates that an 80% criterion is acceptable for procedural integrity. And so keeping this criterion in mind when evaluating our data collection, we can say that this 80% criterion for treatment implementation was actually met. And this is pretty exciting to see, as not only was it met after 7 weeks of intervention, but you guys did an excellent job at implementing the intervention with fidelity over the last 7 supervision sessions that we've had together with 100% fidelity. So I just want to take a moment to commend you guys on that. And now looking at the data accuracy review, this is looking at our inter-observer agreement, and we used a trial-by-trial IOA to measure the reliability and accuracy of our data to ensure that when we were delivering FCT interventions, that the data we were collecting during this time had a high degree of accuracy, again, as this data is used to support the treatment decisions we're making for LP. We wanted to make sure that there was a high degree of reliability with that data that we were collecting. So for the last 6 months, similar to the fidelity checklist data, it was the same process, that it was collected initially at a weekly basis for the first 3 months, and then for the last 3 months we have been collecting our IOA data bi-weekly. The behavior analyst and school psychologists, again, were responsible for collecting this IOA data, and as far as the IOA data results go, an 80% criterion, again, is what is acceptable for IOA data according to research. And so keeping this criterion in mind, we can see that at the graph that we're going to go to next, that this criteria was met. And it was met pretty quickly, actually, after only 3 weeks of the intervention. By that 4th supervision session we had together, we can see that we achieved that 80% IOA data criterion. And then that continued to increase over time, and such that the last 7 supervision sessions again that we had together, we could see that there was 100% IOA data that was collected here. So great job on that again, you guys. Now looking at the treatment data review for LP, we're taking a look here at a graph that is demonstrating his reduction in the hair pulling of self behavior. So we can see on the left-hand side, the numbers here indicate the frequency of his engaging in hair pulling of self. And here we can see during baseline that the highest incidences that he engaged in hair pulling of self was at 16 frequencies of that. And then we can see the dashed line indicates that we are going over into intervention. And so once the intervention started, we could see that there was initially some variability with the data. However, we did see that decreasing trend in his hair pulling of self as he was engaging in less of that over the treatment as it progressed. I do want to make a note here that although we saw that decrease in trend and then eventually occurring at a stable and low level rate, followed by 0 occurrences of his hair pulling of self, we did see 2 instances in which they were pretty high during the treatment process. We have data, ABC data, that indicates that on these 2 specific sessions, he missed medications on that day, so that could potentially be a variable that contributed to the increase in that behavior that day. The next component here that we're going to look at, this graph indicates the progress of LP's engagement in the replacement behavior, so his functional communication responses. So we can see again with the frequency during baseline, it was occurring at a 0 rate, so he did not engage in any instances of functional communication responses, and then once intervention started, it continued to occur at a very progressive rate, that it was at a low level but with an increasing trend with minimal variability to no variability, and it continued over the rest of the treatment to a very high level with minimal variability but still at an increasing trend. So this is pretty exciting to see that he went from 0 instances of engaging in that functional communication response to I believe it was 25 here, 25 instances of engaging in that functional communication response. So now looking at the ethical and compassionate components here, we just want to take a closer look at identifying, was this treatment effective? And in considering the reliability of our data and the fidelity of our interventions, and looking at the graphs to see during intervention, did we see a decrease in the challenging behavior and did we see an increase in the replacement behavior? Considering those 4 aspects, we can say that yes, the treatment was effective, as we had a high degree of reliability with our data collection and we had a high fidelity with the implementation of our intervention. And when implementation of the intervention was being implemented, we could see that the behavior, the target behavior, we saw a decrease in that and an increase in the replacement behavior. So with having that in mind, we can say that the outcome criteria for our treatment for LP was nearly met. And I can say nearly met just because we're going to take a look down here at the bottom of this slide. It's a summary that kind of summarizes our outcome criteria in that LP needs to be engaging in a decrease of hair pulling and an increase of functional communication responses across 5 consecutive sessions across 2 or more people and settings. So looking at that outcome criteria, we can say it was nearly met. However, there are some changes that we need to make to the intervention just to ensure that we are going to be meeting that outcome criteria, and those changes will be that we need to be incorporating new people and new settings into the intervention. So moving forward, we're going to be doing that, but we will also continue to be taking our IOA data and fidelity data, and you guys are going to continue to record data on his target behaviors and replacement behaviors. So looking at our next steps, our treatment action plan for LP, we'll be looking at the 3-month plan we have here to incorporate new people and places into the intervention. So with staff, we will be including the librarian and some of his gen ed teachers into the intervention. Specifically with the gen ed teachers, I believe it's 4th and 6th period teachers. And then looking at the interventions in new settings, we're going to be including recess and gym into the intervention settings. And here I just want to emphasize with this 3-month plan, the intention behind this is to ensure that we are achieving generalization across settings, people, and time to ensure that the behavior can generalize and maintain in these settings with these new people. So keeping all of that in mind, I do kind of want to shift gears and looking at some ethical codes, as we do want to ensure that we are embracing an ethical practice and a compassionate practice as we are approaching our interventions with LP and our data review that we've been doing. So code 2.18 is a code that we can reference that indicates that we need to continue to evaluate these interventions to ensure that we are seeing effective outcomes with LP's treatments. And that's what we've been doing here today. So code 2.17 talks about how we need to be ensuring that our data is what we are using to serve as the basis for our decisions, for making those decisions on LP's future services related to interventions. So again, these are just some codes that I wanted to bring up today that are relevant to what we've been doing with our data review. And if you have any questions, please ask me if you have any questions on the ethical codes. So I'm going to leave this here saying that we are going to meet for our next data review meeting on the 2nd of October. And until then, you guys are going to continue to do awesome things with collecting data on LP's target behavior and replacement behaviors, and we'll continue to collect IOA and fidelity data every 2 weeks. Until then, thank you guys again, and I'll see you next time.